prospect of socialized healthcare here in the United States has sparked heightened scrutiny of such systems already in place in other countries, particularly Britain and Canada. That has prompted some citizens of those countries to rally around their systems and issue impassioned counter-arguments. A case in point is a duo of editors at the Financial Times of London, Timmins and Richard Edgar. They made a video of themselves discussing Britain's government-run healthcare system in reaction to the criticism it has been receiving from those who don't want a similar system in the United States.
Back to the Financial Times newsroom. In an increasingly bitter debate about healthcare reform in the United States, the NHS, the National Health Service...
But it's one bizarre interview, not for what they talk about, but for what they don't talk about. The most oft-heard criticism regarding the state-run British health system is the R word, rationing. For example, based on the most recent statistics I found, which were for 2004, the average wait time for a hip operation under Britain's National Health Service was 11 months. The wait for a knee replacement was a year. During the discussion between the newspapermen, there was an 800-pound gorilla in the room, plopped down right next to them.
Yes, well, I mean, there is, some of the allegations being made against the NHS probably are true. I mean, for example, some cancer survival rates are lower here than they are in the US, and that is almost certainly true, though you have to be quite careful because some of these international comparisons are very difficult to do.
It's on the forefront of the audience's mind, yet the speakers completely, or perhaps conveniently, avoided the topic. Probably that's because their aim was to put the best face on the British healthcare system, and to have brought up the most obvious and egregious failing of it would have meant viciously rubbing that face in the ground. Among the things they talked about were the lower cancer survival rates in the UK. They also talked about the 10% of UK residents that have private health insurance, the impact on UK domestic policy, but not a whimper about rationing. And incidentally, there's another stark reality about the government-run British healthcare system. Like the supermassive black hole at the center of our galaxy, the National Health Service's gravity is sucking tremendous resources away from the rest of the UK government. At around £100 billion annually, Britain's National Health Service is the single biggest budget item in the government. There are no doubt far fewer funds available for other government services than would otherwise be the case, like transportation infrastructure, law enforcement, and education. Unfortunately, a similar phenomenon is happening here in the United States, with nearly 2/3 of our taxpayer dollars simply being given away as free money to other Americans through programs like Social Security and Medicare, rather than being spent on traditional government services. Many areas of our government are suffering, including NASA, road and bridge repair, national parks, embassies, and law enforcement. That's outrageous. A rich economy like ours should easily be able to afford those things, like we did in the 1960s, when we were able to spend enough to send a man to the moon. But by electing left-leaning politicians, Americans have opted to have our tax money spent on entitlement programs instead. Government-funded healthcare would accelerate that process.